Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome William Hsu. He's an endocrinologist. Today's Kevin MD article is Reimagining Diabetes Care with Nutrition, Not Prescriptions. William, welcome to the show.
Well, thank you, Kevin. Fantastic to be on your show.
All right, so tell us a little bit about your story, and then tell us about the article that you wrote on Kevin MD.
Yeah, so I've been in research and clinical care for over 25 years. And throughout the journey, I've always been asking the question, how can we push the envelope? How can we improve diabetes care? So having been a faculty at Harvard Medical School, then researching and also taking care of patients at Joslin Diabetes Center in Boston, I've been exposed to a lot of new thinking around diabetes, but something still stuck with me, so continue to strike me the fact that we continue to rely on medications as the only way for these age and chronic related conditions continues to bug me. And that's what kind of gave me the incentive to start this article.
All right, so tell us about the article itself, Reimagining Diabetes Care with Nutrition, Not Prescriptions. What's it about for those who didn't get a chance to read it yet?
Well, it's really about rethinking what should it be, because we are all influenced by our past, our history, our training, our environment. And so as a physician trained in Western medicine and teach Western medicine and practice Western medicine, the question is always, sure, we believe in nutrition, and every doctor will tell you they believe in nutrition, but after 30 seconds, let's talk about what medication should be on, right? That's always the paradigm. I taught it to the medical students, I taught it to my residents, to my fellows. And when you ask why is that, it's clearly because it's not because we don't believe in nutrition. Every study shows nutrition works, but the problem is everyday commitment to a lifestyle change, to a dietary pattern is great in studies, but in real life, it's too hard to do. And therefore, we need new solutions. And that's why in the article, I invited the readers to imagine what the new paradigm should look like.
So I'm a primary care internal medicine physician, and everything that you said is right. We always, pay lip service to nutrition. We send people to dietitians. So you're obviously, you're at the Joslin, you're endocrinologist. What are some of the barriers that you see that contrast real life from what you see in studies? What are patients telling you?
Yeah, so this is the typical experience, right? So patient will come to me, they see me, maybe because they like me or maybe not. They would always say, sure, doctor, I will do this, right? You motivate them, they say, yes, I'll go back to the gym, I'll eat better, I'll lose weight. That motivation, I think, begins to drop like the day after, right? And a week later, they already forgot their promise to you. A month later, the results are not impressive. And so this is when study efficacy or study of, sort of the study efficacy versus real world effectiveness, right? So these things really become not gelling together because in real life, many other things occupy our attention. The will is there, but the ability to execute it is not there. So think about every nutrition advice we ever heard from our dietitian, from our specialists like myself, endocrinologists, is that, well, you got to eat better, right? You got to eat less, you got to choose the right food. And now with the new concept, oh yeah, you got to eat at the right timing as well. So that's kind of the new dimension. But if we could really imagine that everybody can now all of a sudden become a saint when they were quote unquote sinner, if you will. I certainly I don't mean to sort of to sound derogatory, but if you could not have followed the right diet for the last 20, 30 years, how can you imagine our patients to all of a sudden be empowered to do the same thing, be a saint every single day? And this is why most of us just say, well, you know what? I'm going to go to medications. And this is also why now when you look at somebody living with type 2 diabetes, on average, they're taking 6 medicine.
Yeah.
Diabetes medicine, 2 or 3, blood pressure medicine, aspirin, cholesterol medicine. Now we become a pharmacy. And because we also do not address the root cause of these problems, we are just treating the numbers. We're treating the cholesterol number, we're treating the blood pressure numbers, we're treating the glucose numbers. I'm not saying that those are not important. they will save lives, but it also results in a couple of things. So number one, chronic illness become truly chronic illness. Instead of a death sentence, now it becomes a life sentence. Now you are committed, you're married to a pharmacy for the rest of your lives. And number two, when you keep addressing the symptoms and you don't really address the root cause, then there will never be a cure. There will never be a remission. There will always be chronic diseases. And those are the things I really want to invite us to reimagine.
So just give us a scope. Let's say, how successful are you to getting people to fundamentally change their diet? Just give us a ballpark percentage. Are we talking about 1 in 10, 10%, half? Just how successful are you in terms of getting long-term lifestyle diet changes in these patients that you see?
I think one number tells us every year we'll continue to see about 1 million new cases of diabetes in the US.
Hmm.
Every year we're seeing more. Every year, now we're talking about over 70% overweight or obese rate in the US. And it's not slowing down. So we're not doing well at all. We're talking about probably, I don't know, 3%, 5%,
Mm.
right? And these numbers are continuing to grow, telling us that we as a society cannot implement all the things in the brain. I'll tell you, Kevin, you and I both physicians, and whenever I walk into a medical office, now what do we see? We see heavy physicians. We see people, our office staff are also struggling with, wait, why? Is it because of the lack of knowledge? Of course not, right? It's the environment. It's too difficult to go into all the socioeconomic and the macro industry, right? What made us continue to be heavy?
Hmm.
But the reality is we're losing the battle.
So you talk about reimagining the paradigm when it comes to that connection between diet and diabetes. So tell us what you're talking about.
I think we have to work backwards. In other words, what is the end goal for these diabetes, for these metabolic diseases such as obesity and diabetes? It cannot simply be a better number. It has to be because if you start with better numbers, then all you want to do is give me the tools that can get the numbers down.
Hmm.
A couple of years ago, about 4 years ago, the American Diabetes Association, the Endocrine Society, and then UK Diabetes and EASD, these European groups, got together and redefined a term called type 2 diabetes remission. Now, that's a term that's borrowed from the cancer world.
Yeah.
You think about oncology, you don't talk about cure, you talk about remission.
Hmm.
And so the experts around the world got together and said, you know what? We really need to reimagine a new end goal that is not just hemoglobin A1C lower a certain number. That's a glucose metric, but rather a state where your A1C number falls below the diabetic range, at least for 3 months without any use of medications.
Hmm.
Now, that's step number one, because without the new goal, you can never begin to go there. Without a new end goal, you cannot work backwards. So the step one in reimagine diabetes care is calling all clinicians, calling all patients to say, hey, you know what? It's a lifestyle-driven disease. We can now at least set the goal to get diabetes under remission.
Hmm.
Not a cure, because we don't understand all the pathophysiology of what led to type 2 diabetes, but at least we can get the numbers down without relying on medications. The big battle here is obviously we as clinicians and we all as patients and communities, we trust our medications as the go-to.
Hmm.
The doctors, as we said, lip service for 30 seconds on nutrition, and then let me give you GLP-1s, let me give you other drugs, class of drugs. We've been trained to do that. So, but this reimagining has to start with a new vision of what we can achieve.
Okay. So what's the next step? How do we achieve that goal?
Number two is that we need to then address the root cause of what we're talking about, right? What are the root causes? Well, it's because of the central obesity. It's because of the incessant eating patterns, right? It's insulin resistance. And we have to begin to not just give a prescription and say, you can do whatever you want, but
Mm.
just take this medicine, but begin to address them. But clearly, now we're running into a contradiction. We just said that you cannot do it every single day, change your lifestyle, but still that becomes the crux of what we need to do, this is where innovation needs to come in.
Hmm.
Right? We talk about lifestyle medicine as the fundamental things, for example, better sleep, more exercise, eat better, better community, reduce your stress, and avoid harmful substances. These are pillars of lifestyle medicine. We understand them. But money and investment and research has to now begin to think about how do we bypass some of these burden of carrying out lifestyle changes. We're in the 21st century. Some of that money going to drugs should be putting into innovations in lifestyle medicine. Are there shortcuts? How do we really change behavior from an easier perspective rather than just say by brute force, by sheer willpower, you got to do this?
So, what are some examples of perhaps some of these innovations that you're talking about when it comes to non-pharmacologic interventions?
So about 6 years ago, I stumbled across a number of research projects and publications focusing on, for example, the idea of fasting. Fasting, but not in the traditional sense of willpower, let's bury it through 5 days of water only fast. But the idea of fasting mimicking diet. Now, as the name suggests, it mimics a diet, but actually gives nutrition. And so it's after 25 years of research by a research scientist by the name of Walter Longo at University of Southern California, $36 million of NIH funding to figure out what actually happens on the cellular level when you eat. It turns out that cells have these ears and eyes that senses nutrients coming through,
Hmm.
and there are certain pathways you activate by each of the nutrients. But each of these nutrient sensors also have a threshold, much like a thermostat. If you don't hit certain kind of temperature, it doesn't trigger your air conditioner.
Hmm.
And the idea of how do you give nutrition right below the threshold of these nutrient sensing pathways, so you can actually hack the system, if you will, provide nutrients while providing the effects of fasting. This is what I mean by innovation in lifestyle medicine, where we know the lifestyle changes, lifestyle interventions such as fasting for a long time could be helpful, but they also come with a lot of burdens and a lot
Right.
of safety issues. So the fasting mimicking diet is one, but many other innovations that shortcuts, right? Sort of these challenges to a commitment to a lifestyle change for life, but still drive tremendous results.
So, what exactly is that? What is a fasting mimicking diet?
It's a 5-day structural meal plan that basically is designed to fly under the radar, like a stealth plane, if you will, that won't be detected by the radars of your cells. Now there are more than 47 clinical trials that have demonstrated or in the process of demonstrating its effectiveness. And I give you one example, a paper that was published in JCM about 4 years ago, looking at 5 days of this fasting mimicking diet meal. It's a nutrition that mimics fasting. Just 5 days alone, while people went back to eating normally for the rest 25 days and repeated for 6 months, total of 5 times 6 to 30 days of intervention compared to a control arm that just, continue with their normal
Hmm.
diet. So, for example, the A1C drop of 1.4,
Hmm.
that's respectable. 22 pounds of weight loss without sacrificing muscle. That's unique. That's different than a drug. A 59% reduction in insulin resistance that treats the root cause of diabetes. And the most differentiated feature is that 67%, we're talking about two-thirds of the people in the study, were able to reduce their medications in diabetes.
Hmm.
So think about that. Do you have 5 days you could give per month? I bet you can. When I was in research and in clinical practice, you ask people, can you do a good diet for every day for 30 days? Everybody say yes, but the reality is very few people
Yeah.
could do it. But if you ask them, can you do it for 5 days? Almost everybody says yes. For my health, to reduce my medications, to improve my outcomes, I could do 5 days. That's what I call innovation in medicine.
So, for those 5 days per month, what does that look like for the patient? What can the patient
Yeah.
expect?
So the first day it's kind of it's an introduction. It's about 1,100 calories, but it's not about the calories only. And then for day 2 to day 5, it's about 700 calories. But again, that's just begins to tell the story. What happened is the macros and the ingredients are carefully scientifically tested from basically, from yeast all the way to rodents and to humans over the course of almost 25 years to see which nutrient sensor can we bypass, can we fly under the radar to generate these results. So it's a 5-day meal, essentially, that's been tested and published to generate these results. For example, lowering the A1C, as I mentioned earlier, lowering blood pressure, for example, reduce visceral fats. And it's simply by activating the body's own ability to heal,
Hmm.
but while supporting with nutrients. And so it's not a drug. It's also not a nutrient in a sense. It's a safe way to activate what's already in your body.
And what does it look like? Is it something, is it like a powder? Is it a formula? Is it specific foods for what does it look like to patients?
Yeah, it looks just like real food. I mean, there are many options to make this in any kind of format we want, but the idea is to, hey, you want people to look at this like lifestyle,
Okay.
right? So it comes in soups, it comes in bars and supplements,
Hmm.
and carefully curated and prepared with specific formulation to fly under the radar for 5 days.
And during these 5 days, because it sounds like the calories is relatively low, we said 1100, 700 for some days. Are patients able to do what they normally like to do during those 5 days?
Yeah,
Any effects because of these low calorie intakes? So, what exactly would a patient feel during those
yeah.
5 days?
So, it is a stress onto the body because it's the stress that forces the cell to say, my goodness, there's no food coming in. So I need to rejuvenate. I need to do something.
Mhm.
And in fact, what happens is the cells begin to digest parts of the cellular organelles, older mitochondria, misfolded protein. This process is so critical, it actually won the Nobel Prize in 2016 called cellular autophagy. Professor Tsumi he won the Nobel Prize for describing that process. So we're creating this artificial environment, but still sneaking nutrients in there while causing the autophagy to happen. So obviously, if the first time doing this is not the time you want to go run a marathon.
Hmm.
This is the time to really allow the body to go through that intended stress, if you will, very guarded, well-designed stress to cause the cells to say, "Oh my goodness, I better chew up some things to keep me going." But after the fast is over, it's the refeeding time. This is when the cells then grow those old parts that it chewed up and return them, right? Regrew them, thereby completing the cycles of cellular recycling or rejuvenation. So slow down, take it easy during the first time. That these symptoms of not, hunger does get better with each cycle. I'll give you another very potent lifestyle medicine intervention, exercise, for example. Exercise, is able to benefit multiple organ systems in the body. How? Again, because it works on the entire system. It's a lifestyle
Hmm.
medicine, much like fasting, it works on the entire body system. The first time you go to the gym, what happens the next day? You're gonna have soreness.
Hmm.
And you're gonna say, "Oh my goodness, my muscle is torn apart." It's good for you because when you give it rest and give it nutrition, your muscle becomes stronger. You have more endurance. You have more strength. You have more flexibility. With this fasting mimicking diet, the same thing happened. The first time you experience it, like it's a shock to the body. But each time when you do go through this, your body's able now to use ketone, use fat as a source of fuel. You become metabolically more flexible over
Hmm.
time. So those feelings of discomfort do decrease and disappear over multiple cycles of fasting mimicking diet.
And how many monthly cycles would a patient have to go through, or how long does it take before they notice an appreciable
Yeah.
subjective and objective difference?
So there was a study published in Nature Communications, by the way, that last year it was the number two most popular downloaded the scientific article from that journal that showed merely 3 cycles of the FMD, we call the fasting mimicking diet, lowers biological age by 2.5 years.
Wow.
This was a study that was done by Yale, UCLA, and the University of Southern California. So it's a very potent interventions on the cellular level that results in reduction in biological age. So for health and for longevity and wellness, all you need is actually 3 cycles, according to the study. Now, if you have a disease state such as diabetes and metabolic syndrome, and you're going for the healthcare reversal, I would always recommend that you talk to your doctor. Be under the supervision of a doctor. Why? Because we know it will change the root cause of these conditions where your medications, your requirement will decrease. And for safety, go through your doctor. We do have a program that pairs the doctor and dietitian together with the product, but obviously you could also go do this under the supervision of your own doctor.
And from a cost standpoint, what kind of cost impact is it going to have on a patient?
So it to me is almost cost neutral. Why? For the 5 days that you're on this per month, you don't buy groceries, you don't go shop, you don't go out to eat. I don't know, Kevin, where you stay, how much per day is your grocery, but the product alone, if you will, is south of $200.
Hmm.
And so we're talking about $40 per day,
Okay.
and which is almost cost neutral.
So
On the
$200
healthcare,
for those 5 days of the fasting mimicking per month.
that's right. To
Okay.
me, it's a swap. I live in Boston. It's a swap.
Hmm.
It's cost neutral, and it reduces your biological age. It reduces your visceral fat. On the healthcare side, because now we're putting a lifestyle medicine board certified physician, we're arranging a registered dietitian to support you every other week, twice a month for the course of that diabetes remission and regression. It's south of $300, including also labs and also lab monitoring, an app, but also the product, the suite of nutrition product, including the fasting mimicking diet, south of 300.
And in general, how long do patients have to stay on this diet? You mentioned earlier they
Yeah.
have to speak to the physician, but on average, how long do they stay on this diet?
Yeah, I mean, we were informed by the clinical trials that we published in the metabolic health. We generally recommend a 6 month program. For diabetes remission and regression, we're talking about probably a 12 months journey to change the composition of the body, to rejuvenate and reprogram the cells, and so that you get to a stage where you rely less and less on medications over the course of 12 months.
We're talking to William Hsu. He's an endocrinologist. Today's Kevin MD article is Reimagining Diabetes Care with Nutrition, Not Prescriptions. William, let's end with some take home messages that you want to leave with the Kevin MD audience.
I think, for a long time, we believe change in our lifestyle is fundamental to our health. And I still believe that. I still believe that. But now we live in the 21st century. There are now new innovations such as the fasting mimicking diet that can help hack, circumvent, and still get the benefits of these long-term lifestyle changes with much easier interventions. This is where medicine should head to, and I invite you to look into it.
William, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Thank you, Kevin.